Hello, student. Now, today we're going to spend some time of this multi-causation disease model. Now, what it simply means that a disease or sickness is not just caused by one thing. There are multiple factors. At times, some of those things could be genetic in nature, or could be your environment, the place you live, the sort of healthcare system you receive, or you're exposed to, type of water, the water quality that you drink. Is there an infectious disease outbreak in your community? The air pollution, the sort of economics. Do you have a good employment? Do you have money to pay for rent? What sort of house do you live in? Again, the quality of your environment. As you can see in these circles, you have three. These are all external. It's not because of you, it's where you live or the conditions you're exposed to. Now, they have the middle cycle that says your personality, your beliefs, and your behavioral choices, more or less your lifestyle. See, at times, some of us don't make the best choices when it comes to our lives or when it comes to our health. And some of the choices we make most of the time could lead to some health-related issues. So, your beliefs, what you believe in, at times your beliefs can go directly opposite to your health, the quality of health choices that you have. Your personality, are you somebody who is always, as he says, sour or bitter, somebody is always mad? Or are you somebody with a charming personality, somebody who is really welcoming? You see, because all of those kind of attitudes or tributes, most of the time do not help. Are you somebody with a positive attitude or a negative attitude? Again, these are things we have to watch out for. People with negative attitude most of the time create situations wherein or make choices that will negatively impact their health. At times, blood pressure. And you have your genetic endowment that you do not have control over. What you inherit. See, the inner, the one, the yellow, you don't have much choice. Just as we don't have, at times, we like to inherit the way our parents look, or their wealth, or their names. But there are certain times also we inherit some things we don't want. The sort of diseases or sort of illness that runs within the family. See, all of these things are things that can impact your health. You see, but most of this can help you if you know. Sit down with your dad, your mom, uncle, grandpa, aunt. Let them tell you, oh, what did grandpa die of? What was he suffering from? If they say, okay, he died of cancer, maybe you as a child have to be very, very, especially what type of cancer, you have to be on top of it. You and your doctor have to work on it so that if at all it resurfaces or it comes out or you exhibit those symptoms, it can be really easily taken care of at very early stage. Don't wait until it's too advanced, then it becomes a challenge. Or was there hypertension or heart attack or diabetes? See, all of these are certain things at times runs within the family. So you have to make sure you know what are some of the diseases that runs within the family, and you try to understand them more, and you do all that you can take to prevent. Try to know the risk factors. What are some of the risk factors for some of these diseases to be established? And you make sure you address the risk factors. If they say, okay, try not to engage in so much fatty food. Fatty food tastes great, but at times it leads us closer to our graves. Even though there are certain times it's easier said than done, because if you don't have the means to get all those nice groceries, healthy foods, most of the time, but again, you try your level best to make whatever you can do to prevent you from coming down with the disease. Or if it comes down, if you are aware of it, you seek treatment as, as soon as possible. Now we go to the non-communicable diseases. I think this we already, diseases of the heart and blood vessels. So diseases of the heart and the blood vessels. You have the coronary heart disease. Again, the heart and the blood vessels. At times when the blood vessels are filled with cholesterol, shrink their possible ability to be able to allow blood to flow readily within the vessels. That can create a problem for the heart to pump blood to the various part of the body, and it gets to a point wherein, you see, as I always tell people, your heart is about the size of when you fold your fist. It's not something that is really that big. And therefore, we try as best as possible. Don't put too much weight. Because when you allow yourself to be obese, then it becomes much of a challenge for the heart to be able to circulate blood throughout your body. And that can lead to some problems. So it's very, very important to make sure that don't think your heart is as big as you are. No, it's a small machine. And when you put a small machine to a big truck, most of the time the machine will not work for too long. So remember that. Exercise. Try to eat well. Avoid eating fatty food all the time. I don't say don't eat fatty food, no, because we enjoy those things. But try not to eat them every day. Try to alternate your diet. Then you have the cerebrovascular disease, which must contribute to stroke. Now, again, stroke usually occurs in the brain. Blood vessels break, and blood is discharged into the brain. That part of the brain that controls certain part of your body will be disabled. So you have to always make sure that you watch your blood pressure, watch your the way your heart functions, and just go for frequent medical checkups. That can really help. Then you have the malignant neoplasm. Malignant neoplasm is cancer. Cancer is non-communicable. And most of the time, cancer forms, as I say, a new good cells go bad. Wherein you have a normal cell loses its ability to control its growth, and it starts to grow, and then start affecting other organs in the body. And most of the time, the earlier it is detected, the better it is for it to be treated. The later it is, the more difficult it becomes. That's why I said it's good for you to know family history, because there's always a certain percentage that if your dad has it, you are likely to have it. So, I don't want to say you will directly have it, but the possibility is there. So you do the best that you can. You have the chronic obstructive pulmonary disease, lung diseases. See, and one of those big lung diseases, one of the contributing factor is smoking. See, smoking in all its form is bad. Don't smoke. Smoking is not good. It makes you stink. It makes you cough. And down the road, if you don't watch it, it also increases your chances of developing lung cancer. So don't smoke. In any way that now you have vaping or this, just don't do it. Try as best as possible. If you've started smoking, stop. Find ways for you to be able to do away with smoking. Because if you smoke, it will hurt you down the road. Then you have diabetes mellitus. Now, you have diabetes is something also that is common within. You have type 1 diabetes and type 2 diabetes. Type 1, usually people are born with it. Type 2 later manifests itself. And most of the time, type 2 could be as a result of lifestyle related. Type 1, you kids are born with it. The control of the insulin and regulation of sugar within your blood. Then you have chronic liver disease and cirrhosis. Sclerosis of the liver, hardening. Most of the time, this is caused by drinking, excessive drinking, alcohol. When I say drinking, I'm not saying drinking water. Drinking alcohol can cause that. So these are lifestyles, some to a certain extent. Some of it could be genetic, yeah, but a good chunk of it could also be facilitated by lifestyle. So now that we've known about the diseases, how can they be transmitted? The big push now is how can we prioritize prevention and control efforts? How can we prevent? There are a lot of ways in which, okay, we can prevent. And there are a lot of things that we can prevent against. But at times we have to also prioritize. What is the best way we can prioritize to prevent? Prioritizing prevention and control efforts. The criteria used to judge importance of disease to our community. See, when it comes to prioritizing, you see how many people within the community die from this disease. It's what is the leading cause of death within that community. Then that disease needs to be prevented or find a way in which it can be controlled or be managed. And at what age does this disease really affect people? Because the age also will tell you the potential of life lost. You see, because most of the time, if the disease is really affecting people in their, say, 70s, 80s, 90s, yeah, they will try to control them. But most of the time, it's like, if the person is in their 40s, 50s, or 30s, most of the time that can be a priority because there's a lot of life to live. So these are also, when you talk of prioritizing diseases, even though no life is really allowed to die just because of, but most of the time because of trying to prevent some of these diseases, resources are not finite. There are certain limited resources. So most of the time, again, it's a matter of what can give us more for the money we're going to spend. Unfortunate. And at certain times, it's even some of these people not only using some medical stuff, but there are certain times wherein I don't know. Because when you start saying prioritizing or whatnot, what life is more important than the other? Which life are you ready to forego? See, that becomes a value kind of system, If every life matters, then do the best that you can so that people can be able to live their natural lives. Okay, economic costs associated with disease. Yeah, money spent at various levels of government. Example, on alcohol and other drugs. So especially in our capitalist system, everything, most people pray to the altar of money. You see, whenever something happens, the first thing is, oh, how much is it going to cost? Not knowing that, okay, yeah, I don't want to say forget the cost, but think about what can you do to improve the life of that person, the quality of life. It's a given. There are two dates that everybody is aware of: constant. Your day of birth and your date of death. But the longer you can prolong those, the better. And it's not the best way most of the time for people to look at it in terms of cost. It should be looked at in terms of quality of life. For all, at all times, black, brown, white, we are all human beings, and we should be provided those qualities, those services, those conditions that can prevent us from getting some of these diseases and dying at a much younger age. It should be a commitment of those in power to making sure that all Americans are given equal chances of living a healthy life. Then we come to prevention, intervention, control, and eradication of disease. Prevention, as a definition, planning for and taking action to prevent or forestall onset of disease or health problems. Planning for and taking actions to prevent. Say, for instance, you want to prevent high blood pressure. Most of the time, what are some of the things that they say? You exercise, you eat certain type of food. Exercise, eat certain type of food that is away from some of this fatty food or some of this salty or processed food. Stay away from those. They might taste good, but they cause havoc to the body. So those are when you say taking action. Those are the action you take. Exercise. Eat in moderation. Don't just eat because food is there. So much of the food, some of the food is going to be converted to things that cannot be helpful to you. So eat in moderation and exercise if you can. Or forestall onset of disease. Again, if you know this disease is in the family, you can do certain preventive methods, preventive ways, know the risk factors, then work against to prevent those risk factors from affecting you. You can forestall, you can slow it down. Maybe instead of hitting you in your 50, it might hit you in your 70. At least you have some good time. So again, one of the best way to prevent is don't be afraid to know your family history. Don't be afraid to know what are some of the common diseases in our family. What are some of the common diseases in my community? And know what are some of the causes of these diseases and see what you can do. Interventions, efforts to control disease in progress. Because when the disease is already established, now you have to intervene. Say you have a high blood pressure. The disease has already been diagnosed. So now you control the effort you take to control the disease in progress so that it does not become something that could be fatal. So you take actions during an event. Control, you try to the containment of disease. At times you can control it. You can control the disease so that it does not progress to become much more destructive. A lot of people live with hypertension, live with diabetes, live with even with cancer, because there are certain interventions now that can keep it under control. A good example, people with HIV. Now there are certain medications that people have to take that, yeah, the HIV is controlled. It does not advance to AIDS, then to AIDS. Eradication is the total elimination of disease from human population. Some of the infectious diseases have been eradicated, things like polio, chicken pox. You say because of the advancement. Even though some of these things here and there, they keep resurfacing because of poor environment, poverty, and people are moving around much more easily these days. So those things can also be a problem. Primary prevention. Prime, the first. Primary prevention is forestall onset of illness or injury during pre-pathogenesis period. So either you forestall the onset of illness or injury during before the disease really enters the body. I say because at times you can forestall, you can stop it, stop the disease track. Good example of primary prevention. You know your partner, or your partner is honest enough to tell you that he or she has some form of STI, sexually transmitted disease. And you know the pathogen exists in bodily fluids. So one of the things that you can do, especially when it comes to preventing, you make sure you protect yourself. You don't allow any break or any possibility for you to exchange fluids, especially during sexual intercourse. And most of the time, people are advised to use condoms. And you have to use it the right way, because most of the time using condom, people have said, oh, I use condom and this. But if you don't use it the right way, you will not get the results that you're looking for. There's a right way of using it and there's a wrong way of using it. How do you store it? Do you put it in your back pocket and sit on it for days? And how do you put it on? How do you take it out? Because these are all important steps, because all it takes is for a little break and all your effort is wasted. Because a little break will allow whatever infection that is there to pass through that little break and enter into, on somebody who is susceptible, and that person becomes a host. Then you have secondary prevention, early diagnosis, and promote treatment before disease become advanced and disability severe. You see, now here is when the disease is diagnosed, then you start having treatment. And one of the ways also when they say and the disease has been diagnosed and you start having treatment, make sure you follow the direction of the treatment. Don't just stop when you think, oh, well, I'm feeling better, therefore I should stop taking the medication. Because if you do that, all you're doing is you're just creating more problems. Because especially if it's caused, the disease is caused by a microbe, then you allow that disease and the microbe to mutate. And when it mutates, it becomes difficult for you to treat. So therefore, especially, that's why with antibiotics has, and now most antibiotics that are there are not that good, because people have misused the use of antibiotics. And now the bacteria that causes the disease mutates into another form, and the medicine that was used to be able to treat that disease earlier, before the mutation takes place, now is less effective. So that's why, if you go to the hospital and you are given 10 pills of antibiotics, make sure you take all 10 pills. Don't just take 2 or 3 because you start feeling good and this, you stop. No, you follow the guideline that was given to you by your doctor or by your pharmacist. You take it until they are all over, because that is the amount of toxicity that should be within your body to kill that bacteria. When you stop early, you've not really allowed enough to really kill that bacteria. So the bacteria gets stronger. So always make sure that you finish the medicine that is given to you when you have any form of ailment. Then you have the tertiary prevention. Tertiary prevention most of the time is once the disease is being treated, you have to go back to your normal life. So most of the time they retrain you how to, therapy. Therapy to a great extent is a form of rehabilitation. They re-educate you so that you try, make sure you don't do the things that you did, try to prevent. And they rehabilitate, try to get you back to your normal lifestyle. So the 3, primary prevention is to forestall. Secondary is to treat. Treat, once the disease has been known or diagnosed, now it's treatment before the disease gets worse. Now, once the disease has been kind of put under control, you go through the tertiary prevention, which tells you also again, gives you the same information that was given to you at the primary, things that you should not do. Because if you do the same things again, you will come here again. So don't do it. Then they will also give you an advice about some aspect of the secondary. But the main focus is to get you back into your normal functioning and stage. Primary prevention of communicable diseases. Strategies at its link in chain of infection. It's the communicable diseases. Now we said that there is a chain or the triangle. We have to find a way to break those links, break the chain. Individuals, especially when you're dealing with infectious areas, you have bacteria that causes certain diseases. You wash your hand. Hand washing is part of the primary prevention. And one of the things that you hear when Dr. Fauci speaks about the coronavirus, hand washing is one of those things that he uses. Now we can also even say not only hand washing, but mask wearing proper. And we can also say the distancing, 6 feet from people you're not familiar with, you don't know, not part of your family. So hand washing is great. Using a mask prevents airborne diseases. Then you think of condoms, using condoms. You use condoms to prepare, create a barrier between the infected host from introducing any bacteria or any virus into the uninfected individual. Wear those condoms properly. Then food. There are certain diseases that are also in the food we eat. Make sure what is to be cooked should be cooked properly. What is not to be cooked should be washed properly. Wash them properly. Chicken at 160, meat. There is nothing good about, oh, I want my meat rare. No, or medium, no. Your meat should be cooked, properly cooked. You taking chances when you, oh, I want it medium rare. I want my prime medium rare, or I want it medium or rare. No, it should be cooked. And again, during holidays, wherein food is prepared for a lot of people to come take part in, make sure the food is always kept warm. Cooked food should always be kept warm. Cold food should always be kept cold. And yes, people should wash their hands and do not touch the food. Use utensils. Then you have communities. You have to chlorinate the chlorinating water supply, put some chlorine in it so that you kill possible microbes. Inspecting restaurants so that they know when they go, place you go to eat is properly kept. Foods are properly stored. Cold food stored cold. Hot food stored hot. And you don't put raw meat or raw chicken or whatever on top of other produce. Because again, there is the possibility of cross-contamination. Cutting boards should always be kept clean. Those for veggies or whatnot, and those for fish, and those for, there should be different cutting boards. And yes, the cooks should be clean. Proper clean uniform. Because when people are clean, most of the time they are likely to do clean things. They appear filthy, watch out. Then you have the immunization programs for all citizens. This is also extremely important. People need to be immunized. See, right now we're trying as best as possible to create that situation for the coronavirus. Please encourage your family members to take this this vaccination for the COVID virus. This is no joke. This is no game. Take it to protect yourself as well as your family members. Yes, things went wrong some years ago, but now people are watching. Those kind of things are hard to happen today when too many people are watching. And you control the vectors, mosquitoes that carry malaria, and you have some other disease, some animals who carry some of these other diseases. See, because some are vectors, they act as, those diseases, or this pathogen lives within those individuals. So when you control those, you create a situation of proper health for people. Solid waste disposal. Again, fecal matters should be disposed properly because they are breeding grounds for microbes. And if not controlled properly, it can lead to outbreak of infections. So, fecal matters should be disposed properly, and or even at hospitals, any solid waste or whatever should be taken care of in the right way possible. immunity. An important component of primary prevention. So immunity, in fact, that is why they are trying to have this herd immunity, so that if many people are vaccinated, there would be a situation wherein there will be enough antibodies that can prevent people from passing on this disease from one person to another. You see, immunization creates, when you are immunized, your body develops antibodies against that disease. So when you have the antibody against the disease, say like now, people that have been immunized now have antibodies against the COVID-19. So if they are exposed to COVID-19, those antibodies are just like the baddest kind of security people that can fight against the COVID virus and prevent it from affecting, from entering the individual and establishing disease. So that's why it's important for people to really take this vaccination. So active immunity occurs when exposure to disease-causing organism prompts the immune system to develop antibodies against that disease. Then you have passive immunity occur when a person receives antibodies against a disease rather than their immune system producing them. So that's why it's very, very important. Passive, when a person receives antibodies against a disease rather than their immune system producing them. Secondary prevention. Now, individuals, see, secondary prevention at the individual level. At times, some people self-diagnose, self-treatment with home remedies. Some people take antibiotic prescribed by a physician. So most of the time, we, especially some of us, oh, I have a headache. As I know, I've diagnosed myself having a headache. So what do? I self-treat. I know if I take Advil or Tylenol, my headache will go away. Or if you have antibiotic prescribed by a doctor, that can help. The self-diagnose is great, but there's a limit. If you self-diagnose and you self-treat and the disease or the pain does not disappear, it means you are not diagnosing the right thing. Because symptoms can be manifested for different reasons. You can be having a headache. Maybe your headache is because you are suffering from something else other than dehydration, or something else might be developing in your body that you are not aware of. That's why with self-diagnosis, if you self-treat, the symptoms disappear, that's okay, or with other home. But if you self-treat, you self-diagnose and you self-treat, and the disease still persists, my advice is it's time to go see the doctor, because the doctors have better ways to be able to diagnose you better to really know what is wrong. They can do a blood work and see what is going on within your blood, what is really happening. So don't just say, okay, now, especially if you have a headache and it takes a week or two, or you have the headache, the symptoms subsides, then after some time it comes back, it's time for you to go to the doctor for treatment, for better diagnosis. Communities. Within the community, controlling or limiting extent of an epidemic. When an epidemic occurs, try to control it. Try carefully maintaining records, investigating cases. And if you realize that this is a disease that spreads, you do isolation, keep the person, so that they do not infect other people, keep them in quarantine. That's why most of the time when people say, okay, you have this, you stay away from others so that you don't infect others. In fact, during on my regular teaching, if a student has a cold, I usually say, okay, depending on how you feel about the cold, just let me know, but stay home, because I can teach the class with one less student. But if that student comes to the class and infects the other student and everybody is down with a cold, I don't have a class to teach. So I always say, okay, if you are really feeling this, please stay home. Just let me know. Send me an email. I'm good. I'll work with you when you are okay with your cold. And most of the time, I'll also advise you, go see your doctor so that you get the right type of diagnosis that will be followed with the right type of treatment. You have the quarantine, or you can disinfect the place. There are a lot of disinfectants that you can spray to kill all the possible microbes, the possible diseases that are around. So tertiary prevention of communicable diseases, individuals at the individual level, recovering to full health after infection, returning to normal activity. So that's at that level. At the community level, preventing reoccurrence of the epidemic. So once you now know, you do the prevention, this was caused by a certain bacteria or cholera. You make sure that all drinking water is, and at times you hear wherein people are saying, try as best as possible. Try as best as possible. When in fact the water is infected, don't allow people to drink that infected water. Because if they do, they will be infected and the disease will be passed on. You do removal. Okay, when people are dead, you make sure you remove them from their community and from their homes. At times you do the embalming so that you take away all possible that with special chemicals. Then the burial of the dead. You don't leave the dead to decompose. because not only will they stink, but they can also spread diseases within the community. Then you go back to the reapplication of primary and secondary measures. Primary prevention of non-communicable diseases. At the individual level, you have to have that education and knowledge about health and disease prevention. Don't be afraid. Find that knowledge. Go to the Centers of Disease Control website. Go to the NIH website. Go to the Medline Plus website. Go to minorityhealth.org because they carry information that is relevant to minority people. Don't be afraid to know, because knowledge, when applied properly, can prevent you from pain and poor health and early death. Eating properly, I've said it, adequate exercise, driving safely. See, most of the time, driving recklessly, you might want to go to a place so fast, if you don't watch it, you will never arrive. Because you can get into a wreck and hurt yourself and even hurt others. So driving, you have to drive safely. Always wear your seatbelt. Within the communities, what communities should do is adequate food and energy supplies, efficient community services, opportunities for education, employment, and proper housing, good, healthy housing. At the continuation, at the individual level, personal screening. Again, you go to your doctor, you have this mammogram, PAPS test, PSA for prostate, regular medical and dental checkups, pursuit of diagnosis and prompt treatment. Again, keeping your mouth healthy can do a lot of good for you. Not only prevent you from having bad breath, but can prevent your gum from decaying, because it's through the gums that are decaying that other microbes, bacteria, and other things can enter into your bloodstream. That can lead to heart problems and other issues. So those teeth that we have, it's good when you keep them clean, you keep your mouth clean, regular brushing, regular checkups, and keep them always clean. Now, communities, their role can be provision of mass screening for chronic diseases. Again, most of the time when we talk of environments, some of the social structures where people live, are there opportunities for this mass screening, wherein there will be a period wherein doctors, nurses come around to your screen or provide service. There are certain times wherein at VSU, we used to provide this dental cleaning. You have dentists from VCU, they will come and just provide just dental clinic, extract some tooth, do some root canals, and just help people to maintain their health. Individuals at the individual level, you have significant behavior or behavioral or life changes. You have to adhere to some of these life changes that you have to make. Adherence to prescribed medications. As I said, you adhere to what the doctor said. If you have to take these 10 pills, 5 days, 1 in the morning, 1 in the evening, you do that. You don't take 2 in the morning and say, oh, I've taken them for the, no. The doctor says 1 in the morning, 1 in the evening. So within 5 days, those 10 pills will be gone. And make sure you don't say, oh, well, let me take 3. No, you follow, you adherence to prescribed medications. And most of the time, because you don't share medications, if your brother had a headache or something and he went to the doctor and the doctor gave him some medication, it doesn't mean you, because you kind of showing the same symptom, you can take that medication. Don't do that. And your rehabilitation requirements after surgery. Now you have communities, adequate emergency medical personnel, and services. You have hospitals, surgeons, nurses, the ambulance service. See, but how many of these things that I've just mentioned do we find in some of those poor neighborhoods or those rural areas? Some of these things are easily, you can almost, in urban areas, you have hospitals, you have surgeons, nurses, ambulances. But do these things exist in some other communities wherein the poverty rate is low, wherein you're talking about the low class, the lower class of people, or at times in the rural areas? See, great if these things are evenly distributed within the entire country, but unfortunately it's not. These are discussion questions. Which component of multi-causation disease model and can communities most effectively impact? You look at some of those things that are within the outer layer, communities can bake. As I said, we have 3 circles. The inner circle, community has no, because that is your genetic. The next is your personality, kind of part of genetic in a way, but the bigger circle is your environment, is your society. Your community can impact greatly in trying to improve that. Which level of prevention is most important for better community outcomes and why? The most of the 3 levels, primary, secondary, and tertiary, the best level of prevention is the primary, because it's cheaper to handle. and it improves quality of life. Secondary cost money, and most of the time, once disease has established, most of the time, people really don't get back to their maximum function. Same as the tertiary, same, you try to rehabilitate, but at times people don't get back to their max. So the best thing is everything being normal is primary prevention. Who plays a more significant role in preventing disease, individuals or community? I think both play a different role. Individual, they play their part. And besides, individuals are also part of the community. So it's not one or the other. Yeah, the individual, you can play your part to prevent you from getting it. But communities also can create resource, that resource pool, wherein if something happens, there is a way wherein collectively it can be handled. Okay? You take care. Please take time to read this chapter. I might have gone through some of this over and over, but I just want you to make sure that you understand some of these things, because if you have a better control of trying to know what is the issue and how you can prevent it, that will help you greatly. That's why I spent some time to go over some of it. So you take care, and we'll meet again at the next class.